Hi, my name is Laura Montgomery, and this is Module 6 assignment for Foundations of Nursing. I chose option 1 as my scenario, and it reads as, Mr. O is 63 years old. He was dizzy and lightheaded at home and almost fell. His wife brought him by car to the ER. Mr. O was admitted to the AMU with syncope. This is not his first time being admitted to the hospital. He has been treated in the past for congestive heart failure and acute myocardial infarction. He feels like he is pretty healthy as he only takes NSAIDs at home for chronic back pain. Mr. O got to the AMU at 1600. His nurse is Jenny RN. Jenny RN assessed him and found his blood pressure to be 138/84, his pulse 76 and regular, his respiratory rate 16. He is afebrile and at 98.6. Mr. O's labs were normal, but his IV infiltrated during transport, and Jenny RN started a new IV and put a warm compress on the old site. Jenny RN reported off to Ben RN at 1900. At 2130, the PCA found Ben RN and told him that he had just helped get Mr. O off the bedpan. Mr. O had a large black tarry stool and was complaining of not feeling well. Ben RN went in to assess Mr. O. His vital signs were blood pressure 94/66, pulse 114, his respiratory rate 24, and his pulse ox was 97. He was pale and his skin was clammy. Ben RN asked him how he was feeling, and Mr. O said that he just didn't feel well and could not get comfortable. He asked if he could have something for his belly. It really is hurting. Ben RN assessed his abdomen and found that it was distended, and Mr. O had diffused abdominal pain. He rated his pain a 6 on a scale of 1 to 10. So my plan for the S-bar, which S-bar is situation, background, assessment, and recommendation. I don't have anyone to help me, so I'll just enact the role. But this is how my conversation with the doctor would go. I would want to page the doctor if he's not, on call, or if he's not on the unit that I'm on. I would call and ask for him to be paged and wait no more than 5 minutes for a response. If I didn't get a response, then I would find another way of communicating to them, to try to get a hold of someone to give report to and get the patient some help. So calling the doctor, the scenario would go, and we'll just use Dr. Smith for example. Hi, Dr. Smith. My name is Ben, and I'm calling from MedSurg Unit AMU about patient Mr. O in room 210. He is 63-year-old male brought in last night at 1600 for syncope. Mr. O states he is in good health but has prior hospitalizations for congestive heart failure and acute myocardial infarctions. He stated he takes no medications except for NSAIDs for chronic back pain. His previous vitals were taken at 1900 by the morning nurse. They report his blood pressure 138/84. Temperature was normal at 98.6. His pulse was 76 and regular, and respirations were 16. He has a new IV started because the old one was infiltrated, so we had to replace that. Now my assessment at 2130, the patient was found to have excreted some black tarry stool, and I rated his vital signs. His blood pressure now has dropped and is 94/66. His pulse is 114. His respirations are 24, and his pulse ox is 97%. His skin, he appears to be clammy and very pale, and his abdomen is distended and pain radiating all over. He said on a scale of 1 to 10, his pain is at a 6. I'm assessing that he may have some internal bleeding, and so I am recommending that maybe we get some testing done. I would suggest a type and screen of his blood in case he were to need any blood product, a CT scan or MRI of his abdomen to see if there's any blockages within the stomach or intestinal area, and possibly a blood count, CBC, to check his white count and his red count, and a PTT for his clotting factors in case he were to need any type of blood or surgery. And how would you like me to proceed? I feel like if you're available to see the patient, sooner than later, that would be great as well. So just let me know what you would like. And then whatever recommendations he would want me to do, I would repeat back to him. So let's say he wanted to get a CBC order, he was going to order a CBC and a type and cross and an MRI. I would repeat back, okay, so you've ordered a CBC, a type and screen, and a CT of the abdomen. Is that correct? Yes. Okay, I will get those put in, and we will get those as soon as possible. And then I would document the conversation, make sure the vitals were documented correctly, and wait for the results of the patient labs. So some of the questions that were also asked of the assignment were my thoughts on the clinical scenario. I think it's actually a pretty good scenario. I feel like it's an everyday life in a hospital. We see, as a nurse, I think we would see this a lot. So, these are indications that, or signs that we would want to look for in any normal patient: abdominal distension, tenderness, or hardness of the belly, black tarry stools, which I learned was called melena. So decreased vital signs or increased vital signs. So paying attention to what may seem small, but are big indicators of problems. Paying attention to those things is ideal. So this scenario gave good examples of that. What could be added to the SBAR? I do think there's some important information that was missed in the SBAR on this scenario as to if the patient had any medication allergies or any allergies at all, what his temperature was at 2130, because that wasn't stated in there. So I think that would be an indication if his temperature was elevated, that something may be wrong other than the other obvious signs of his blood pressure and heart rate. But he had a baseline temperature, so I think that we should have taken his temperature a second time. If he's eaten anything, because sometimes blueberries, black licorice, other types of foods, iron supplements can also cause black tarry stools. So other than the distension, but making sure he didn't eat anything, because there was no instruction in the scenario that he was not supposed to eat anything. And then there was some baseline lab work done, but it didn't tell us what the results were in this. So having a baseline lab to compare to the labs that we draw at 21 or 2130 would be a good indicator too if his CBC was decreased, if his white blood cell is increased. Those kind of things are important. How could the conversation have been different? I'm not sure unless I'm in like a real life scenario. But I think the doctor would be more involved in the conversation and probably ask a lot of questions concerning the patient's, vitals and appearances, other than what I had mentioned in the scenario. And he may have more recommendations as to how to treat the patient other than the ones that I suggested. And then the significance of the conversation or the situation for the doctor. Well, this situation I feel like is very urgent. I mean, the patient could possibly have internal bleeding and we don't know where the internal bleeding is coming from. So finding out where the location of the bleeding is from would be pertinent, as it could be like a life-threatening situation. So, sooner than later would be better to have the doctor involved in the patient care. Okay. And that is my presentation for Module 6 assignment. Thank you.